Hello, my name is Ketty Ruiz. I work as a pelvic floor physiotherapist in Palma de Mallorca, and I am an expert in non-invasive neuromodulation. Today I am here to talk about a 63-year-old patient who had an accidental fall on the beach in Mallorca on a rocky beach. And when she fell directly on the entire left buttock area. A very sharp pain started all over her buttock and the entire leg, which was treated as a contusion. That was August 2020. Remember how things were during the pandemic, and then suddenly in October of the same year she starts suffering from an increasing pelvic pain. Within a few weeks, she couldn't stand this pelvic pain that prevented her from working and enjoying her social life. She didn't take a sick leave, she worked every day, but when she got home, she had to lie down and could do nothing else all day. She had been looking for solutions since October 2020 until 9 months ago. She didn't stay at home, and she tried absolutely everything: conventional external physiotherapy, pelvic floor physiotherapy, intracavitary, electrotherapy, superficial heat, TENS, all types of medication. She was given triptazole, gabapentin, pregabalin, any NSAID. She tried them all because usually the patients have tried all NSAID options available at the market, and she was unable to improve her pelvic pain situation. 9 months ago, she came to our practice accompanied by a doctor friend of hers to try to find a solution. From the very first moment, taking into account that she had already gone through all the other treatments and that I don't have to do anything different, she seemed to me a fabulous candidate for NESA treatment. We started the pelvic pain protocol we have at our practice. The patient slept terribly bad. She had a lot of anxiety. She had fallen into a clinical depression. She was undergoing psychiatric and psychological treatment. She was in pharmacological treatment for this depression. We set those aspects as initial objectives, like the improvement of her anxiety, and started with programs focused on pelvic pain. We started with Program 1 during a half of the session, along with Program 3 since the fall took place in the posterior area, and 15 minutes of Program 7. As the sessions progressed, the patient is very frightened because she noticed the same pain that she had felt when she fell, which was different from the chronic pelvic pain for which she had consulted us. Many of the patients with central sensitization or some of the patients with central sensitivity are going to have that kind of rebound effect. They may develop old symptoms or the pain may increase in the first few sessions. Taking into account that in the beginning of my experience with NESA I found more bounce effects than I had wished, that's something I explain to all my patients, that the first 2 sessions may cause unwanted symptoms. But there's no need to worry because the autonomic nervous system feels shaken with therapy and wants to come out on top. And my patients in general are very happy when they get that kind of bounce effects. After that 4th session, we noticed that the patient was getting much worse with manual therapy, and we decreased the frequency and the intensity of the manual therapy sessions and continued with the NESA sessions. After the 12th session, we also started using conductors. The patient has been changing conductor protocols throughout this time. She did the 45-night sleep protocol and the patient sleeps great. And she is currently changing protocol throughout the day depending on how she feels. She has a whole list of protocols that might suit her. And if she notices urogenital pain, the urogenital protocol is put in place. If she notices sacral type pain, the protocol for sacropelvic pain is put in place, or lumbar or in the pyramidal area, the other internal side. And the patient herself is changing the conductor protocol. We finished the sequenced NESA sessions a few months ago. I have not told you that her initial analog scale was 9 out of 10 when she attended treatment 9 months ago. And the patient currently has a pain of 1 or 2 out of 10, which she doesn't feel all day. We call it white hours, a white days app. Our patients come in with all black days, pain all day long, at all hours and with great intensity. We are getting a gray days to appear. And when we start having white hours and white days, we have a party. Most of the patient's week is already a white nowadays. Most of the week she doesn't feel any pain. She's got some peaks and she contacts our clinic when she needs her NESA session and she tells us, "Well, can you fit me in tomorrow?" And she comes by any time. On that day she says that her whole pain pattern changes and we can postpone individual sessions and treat her when she is feeling better. On October 2nd, today is September 23rd, and on October 2nd, she will go back to work. With job modifications, she will need to alternate between the standing desk, the football, the pelvic and lumbar cushions for sitting down. But she leads a normal social life and is about to return to work. She always says that she earns around 1,000 euros per month because about a month and a half ago the medical court called her to grant her the condition of disability. And of course, she collapsed, her anxiety increased enormously. We had to make some reinforcements with the NESA technology, but she always says that she's only earning around 1,000 euros and she has a mortgage to pay, she's in debt, and she's not receiving any inheritance in the near future. And that with the money she earns, she must pay the psychiatrist, the psychologist, and the NESA sessions. And that the best investment she has made in all these months has been to learn about this technology and apply it to her body. I believe that the important thing is to understand that when you think you have all the answers, your life will change all your questions. That is what will happen to us when we apply NESA technology. In the beginning, we are going to feel as if we were overwhelmed by circumstances. But to be able to accompany our patients in this treatment and to be able to see how their life changes thanks to the treatment makes it all worthwhile. Thank you very much.